Hello, I'm Matthew Overshed. Here at Trigiene Dental, we understand that equipment downtime is very frustrating and costly for the dentist. So with our extensive knowledge of why handpieces fail and wear, we'd just like to share with you a few tips on how you can extend the life of your handpiece and keep it in top quality condition. So with the high-speed handpieces, prior to sterilisation, the first thing we do is remove the burr. We rinse the handpiece under cold running water to remove any external debris, ensuring we don't get any water into the back of the handpiece here. Some people may prefer to use an antibacterial alcohol-free wipe. Wipe away obviously from the back end towards the head. At this stage, it might be as well to check the water holes on the head of the handpiece that they're actually clear of debris. You can do this with a small piece of wire that's usually supplied with the handpiece when it's originally purchased, and you can just clean out the actual jet holes on the head of the handpiece. Take care, because these holes are very delicate and very fine and can easily be damaged, which will affect your water spray. So any serious blockages, we'd thoroughly recommend you actually send this to a qualified repair technician. We'd always recommend that you use a quality manufacturer's recommended oil for oiling the handpieces. This is because these have been specifically developed for maximising the life of the handpiece and oiling the moving parts correctly. Using a cheaper unbranded oil is actually a false economy and can have detrimental consequences to your handpiece. It's really important that we select the right adapter for the right handpiece fitting. So we have here the multi-flex adapter on the oil can ready for oiling. Before we start oiling, first thing to do is to give this a vigorous shake to ensure that the contents in here, which is the lubricant oil and the alcohol, is sufficiently mixed up to give the right mixture coming through into the handpiece. So we take a piece of lint-free cloth or paper, place the head of the handpiece into the cloth and insert that correctly right the way in onto the oil can that is level on the surface. So with the oil can level on the surface and the cloth on the head of the handpiece, we give it 2 or 3 shots of oil. We want to repeat this process until we have no more debris coming through the head of the handpiece. So I prefer to take a fresh piece of lint-free cloth and repeat the process. So we repeat the process until we have no more debris coming through. Remove the handpiece. I'm now just going to spray a couple of sprays into the head of the handpiece where the burr goes. Wipe the handpiece to remove any excess oil. Prepare the handpiece for sterilisation by inserting it into a sterilisation pouch. If the handpiece is sterilised unwrapped, it needs to be stored in an upright position like this following sterilisation to allow any moisture to drain away out of the handpiece. With the contra-angle handpieces, it's important again that we select the right oil can adapter. This is an E-type adapter and the handpiece fits very snugly into there. With the oiling of the contra-angle, the main difference is the actual resistance you'll feel as you try and push the oil through. There'll be the tendency for the handpiece to want to jump off, so you really do have to hold the handpiece onto the oil can. This is because the oil has to work its way through various gears and a drive shaft. The straight handpiece is oiled in a very similar way to the contra angle. It fits again onto the E-type adapter on the oil can. So with the straight handpiece, it's important that it's oiled in the closed position, like so. You can oil it in the closed position or with a blanking burr inserted. This obviously ensures that you do actually have it in the closed position and it can be oiled like that. It's good practice to oil the air motor on a regular basis. The main difference here is obviously you do not run this under running water, but you choose the smaller of the two larger holes on the back end of the Midwest connection. Handpieces should be oiled after every use or every 20 minutes of use. Failure to oil handpieces correctly can invalidate the warranty or lead to costly repairs. Oiling machines are also an excellent way of providing consistency in the oiling procedure, but we would always recommend that you take out regular tests on the handpieces that have been through the oiling machine to ensure that the procedure has been done correctly and there isn't a fault with the machine. So we'd recommend that maybe on a daily basis. Trust you found this video presentation helpful and instructive. If you need any further information, please be free to give us a call on 01642 442 910 or visit our website www.dentalhandpiecerepairs.co.uk.